The price you pay for medical care can vary greatly from one hospital to another.
Well, figures released today by the federal government show that some hospitals charging thousands of dollars more than others to treat everything from hip replacement to chest pain. WSBT's Ted Land looked over the numbers for Michiana. And Ted, how big a difference are we talking about here?
Well, in some cases, it's $6,000 to $7,000. Not as large of a gap as what's been reported in bigger cities, but enough to make you wonder why the prices aren't all the same.
Say you're on Medicare and you need major joint replacement. The price of that procedure can vary greatly from one hospital to another. According to figures released today by the federal government, the average covered charges at Memorial Hospital in South Bend and Elkhart General are a little more than $51,000. At St. Joseph Regional, it's about $45,000. For major heart failure and shock with complications, the average covered charges at Memorial is $29,000, compared with $27,000 at IU Health Goshen and $22,000 at St. Joseph.
You can't just look at one hospital and say they charge more compared to this hospital when they don't provide the same services.
She says it's because each hospital has its own unique costs, like, say, a helicopter, which factor into the prices for treatment. Hospital administrators say the Medicare prices do not represent what most people end up paying for care.
Think of a list price in a car, and insurance companies don't pay list price. They work off of certain discounts, and it depends on how many people they have in the market.
We don't see any patient that actually pays bill charges. Even the uninsured, by federal law, have a discount.
But with cuts to Medicare, the new figures represent a growing interest among patients about how much their care costs.
We have been waiting for consumers to become much more aggressive in asking those type of questions.
The price differences were much smaller here in Michiana than they were in larger cities, especially on the East Coast, where some procedures varied by tens of thousands of dollars. Again, those figures apply to Medicare patients. If you're covered by private insurance or even uninsured, the costs can be much different. Rick?
Interesting to see those numbers. Ted Land reporting live from the newsroom. Ted, thanks.